diaphragmatic surgery that can accomplish things like David could? What if an orthodontist had us both, right? And we said we'd put something together for DSD clinics, and here you go. Is it
Hmm.
just one thing? Look at this case and the prosthetics, the trauma in the anterior mandible that's going to take ridge augmentation and dental implants, and prosthetics must be involved in this case. This is the type of cases we do routinely now, and we
Yeah.
want to be able to share the workflow with you so that you and your team can do the same thing. Or if you can't in a rural area, they can come to Houston, or they can
Hmm.
go to right now, they can go to New York, Miami, Houston, or LA to get a consult and
Yeah.
and have a consult to empower them, maybe just motivate them to find someone in their community. But if they can't, they can come to Houston. We do
Hmm.
we do a lot of cases where people travel to Houston to see our team and go back home, and they're maintained by a great dentist in their hometown, but the intricacies, the complexities of cases like this are managed by people that do it every day.
Yeah, it's very cool because the same way we're doing this webinar, you are both in Houston, I'm here in Madrid, and we are able to be here discussing. I have been planning these cases in partnership with you guys and for other DST clinics, and it's like we are in the same room sometimes discussing the case because this kind of planning we can share, and David, you can jump in the discussion and help a client that is completely far from your clinic. And
Hmm.
I know because I was participating too that you have patients coming from South Africa and even New
Hmm.
Zealand, right? And sometimes they don't find someone that is doing what you're doing there yet, right?
Right.
Uh, and they trust so much in the process that they want to work with someone they really have the confidence that they can follow these plans, right? These plans, what we are doing is a product for what we have been discussing before. Every year after the course, I come back here to the planning center and we implement improvements in terms of
Hmm.
diagnostics and planning. A great example of it is the area analysis, right? Because
Hmm.
the first time you joined us there and you start talking about the total volume and the minimum section, and you use as a reference that people should have at least 30 cc's, and you can correct me if I'm
Yes.
wrong,
Right.
right?
Yep.
And ideally more than 300 millimeters square in the area of
For
the
minimum.
small, minimal, the bigger constriction. Here we see this patient with this uh, reduced posterior area that anyone who is, even if it's not a specialist, but any of our colleagues, by using this kind of information and presenting to the patient, uh, it will facilitate the comprehension, the patient to understand the importance of not just going to the aesthetic outcome with some veneers that sometimes is what they are looking for, but
Hmm.
to investigate and go deeper and and take a break, right? Wait a little bit. Let's investigate more. Maybe I should be talking to David or to Todd. And we also, it's a great opportunity to create a sequence. For this case, for example, um, we plan options, one with just orthognatics, and then the orthognatics was too complicated because it was a segment orthognatics, a lot of expansion, and it was important to do this, to make this mistake in the computer. And the decision was to do MARPI first, that you mentioned, Todd, that you are just removing, and now probably you're going to evaluate patient's area again and to see the improvement. And we have in this area, this colorful area, not a beautiful colorful area, right, David?
Hmm.
STL file that we can just overlap and compare and see the difference. So maybe MARPI improve it enough and this patient is happy, or maybe not.
Hmm.
And let's move to the next step that will be orthognatics, right? So this platform, this interdisciplinary planning, it's something that is the same concept that once you see it, you cannot unsee it. It's really hard to give this step back. And for me to plan a linear case without double checking out this aspect, I really am not sleeping well at night if I do this, right?
Hmm.
So it's something that we are not seeing much in the Orthodontic Congress. I really hope that next year, we have more orthodontists there, because the opportunity to be in the same room with John Karotkin, with Marianna Evans, Claudia Pinter, it's something that you shouldn't miss. But if you are a GP, that you are starting doing your aligner cases and you are in doubt being in the DST community or not, this is a great opportunity for you to be at least very good in seeing it, in understanding, and explaining to your patient. And then the next step will be creating your team, right, Todd?
Yes. Yeah. I mean, I think that the highlights this year for those of you that have never been are that we're adding time and topics. We're adding even more than you see here. We have Claudia and Stanley. We also have, everybody knows Marianna and what she's done for MARPI. In the past, we've had Audrey Yoon. We hope to bring her back next year. We're going to continue with a large faculty, because it's this large interdisciplinary team. Stanley's not only an oral surgeon, he has ENT training. You're getting the best of the best. Even our lunch and learns with Susi Quintana, a myofunctional therapy that works hand in hand with me and David. She's instrumental. John Karotkin, our orthodontist that gets this, that really understands this and can do great ortho with and without it. But to have the check and balance that we have and the quality control we have right now with, for instance, as we're talking, I'm texting Danielle and John saying, hey, we need to do a QC on that case you just saw, because now's the time to document the success of the MARPI and where we headed from here. This is a course that's going to have testimonials from people that have been through MARPI, SFOT, and orthognathics with long-term follow-up. We're going to talk about how we examine them, how we treat them, and how we maintain them. It's going to be really cool for some of the DST clinics to come and spend the day with either David or myself in our clinics. That's really held specifically for DST clinics, because we can't have everybody. It's in the operating room at premier hospitals in Houston with David, and then my private practice in Houston. There's just not a room for a huge crowd. We have to be responsible to the workflow of our practice as well as our patients. I think that, don't miss this. People ask me, say, well, I really want to just come for Friday for MARPI. Well, that's okay, but you're missing out on the magic here. The magic is 3 days of immersion.
Yeah.
You do it or not. I've had many orthodontists tell me that the cadaver part was their favorite part, because they got to really see what a SARPI, MARPI, SFOT is. What is it? How does it influence the nasal cavity? How does it influence the tongue? We can talk about tongue ties all day long. We can talk about instrumentation, from piezo surgery to lasers, surgical tooling to two surgeon MMAs. Like David runs fellowships every year for oral surgeons that want to focus on MMA. So he's operating all the time. Well, maybe not all the time, David, but most of the time with a second operator. And see that magic happen, and to see how we plan to execute with success is something that's hugely unique about this course. I know there's another couple duplicate courses coming online this year. Super proud of that, really, because they're doing it because we did it, and that's awesome. But I've looked at the curriculums, and they're not like ours. They don't have the cadaver dissection, to my knowledge. They certainly don't have this expansive team of faculty, of world-renowned experts. I don't like tooting my own horn unless there's really a justification for saying, man, don't miss this thing. This will revolutionize your practice in your hometown, no matter where you are, in the United States, urban or rural, or any place in the world. And the sooner you bring it back to your community, the sooner you become that differentiating factor of why people come to you first. Or if they don't come to you first, they certainly come to you second or third for your opinion. And that's the power of this course, in my opinion.
Yeah, I mean, I've seen that happen pretty quickly from attendees, even within the year. Become leaders, and you can tell on their social media that their practices are completely transforming.
Yeah, I was mentioned exactly this day. This is not a course for our colleagues to go and super cool post in the Instagram and then forget
Mhm.
about it, right? I'm seeing many of the colleagues working with us here that they are implementing and having great outcomes,
Yeah.
like Jacqueline Low, KT Down, and others that
Yeah.
are doing MARPI. They never did it,
Mhm.
and they are
Right.
doing, because this course is not about these 3 days. This course starts much before and will continue with the support after.
Mhm.
So I know that there are many courses coming that are going to start talking about it, but none they have the experience, the 6 years and all the support. And I can say this with all my confidence. So yeah, I really hope that, well, the past 2 years we were sold out. We are in the same direction for this next one, right, Todd?
Yeah,
To
we
have
got
the full
space, we got
room.
space available, and I like it now, right now, because ideally I'd have the rest of the space filled up with groups of 2 or 3 or 4, right?
Yeah.
Because the magic
Uh,
sh- when we have teams together, when we have
Yeah.
teams, perio-ortho or ortho oral surgery, or like I said, all three, that's where the magic happens, right? To be together, because that's what it's all about. That's what's differentiating. You have David and myself, perio-oral surgery, where oftentimes they don't get in the same room. We are friends. We're partners in treating patients. We see the future together, not distant apart. Collaboration, the opportunity to sit down and treatment plan with your counterparts. You don't feel like you're in a silo or on your own island. You're doing it together, and you have amazing support from each other.
Mhm.
For instance, when I have a complication with something that's not necessarily in my forte, like taking out third molars because someone talked me into it because I was doing other stuff, I have no problem whatsoever texting David and saying, "Hey, man, I need your help." And I would say that, David, you probably have similar cases where, you've called me and said, "Hey, man, I've got this osteotomy site. Take a look, and how can we,
Mhm.
how can
Absolutely.
we reconstruct a papilla?" And maybe we can't always do it, but we're there for each other. And, that's what it should be about. It shouldn't be about this competitive environment where everybody's out for themselves. Man, if you're
Right.
still practicing in that world, I feel really bad for you.
Mhm.
So, and David and I have talked about this on his podcast, is that, man, life's too short to fight the battle of competition. Rise up, man, differentiate
Mhm.
yourself. And what better way to do it than a course like this?
Yeah.
yeah,
Definitely.
for sure. Well said, man. Well, I'm leaving here, Todd. This QR code directs to the website. Okay.
Yeah, yeah. So January
Um,
23rd, 24th, and 25th. If you're a DSD clinic, you want to get a hold of Danielle, and Danielle will be coordinating the Thursday. That's the 22nd, with office visits and a DSD dinner. Um, we'll have a speakers dinner on Friday night and a happy hour for the participants on Friday evening. Um, right in the middle of Houston, Texas. You'll stay at a hotel that's within 2 miles from the Learning Center at a discounted price. All this is available on our website. The website you can get to via the QR code here. It's a nice, usually not so warm time in Houston. Last time it was freezing. It kind of affected some of the travel because we had a freeze that weekend, and the heater wasn't working so well in the building because we just don't use it much. So hopefully it won't be that cold this year in Houston, Texas. It should be nice, and certainly you're going to be in the classroom, so don't worry about the weather so much as getting to Houston, staying in the Galleria, which has magnificent restaurants. It's an immersion course, 3 days of complete immersion. We did, however, this year make it so that you could sign up for day 1 and 2, which is day 1 is MARPI, Introduction to Myofunctional Therapy and Postural Restoration. Day 2 is digital workflows, seeing the full scope of MARPI with Claudia and Stanley chiming in, and then really hitting it hard with DSD workflows for SFOT and MMA. And then Sunday, we'll talk about complications and get into the cadaver workshop. So complications, how many courses are telling you that we have problems? We do, man. I mean, this is reality. We got to know what to do with them. And the more you do this, the more complications you have. And therefore, the more experience you have managing complications. So I would hate to be on an island someplace where my first complication came along and I got no one to turn to. I just got to guess, right? Chances are David and I have seen it. And not just David and I, but the entire team. Chances are we've seen it, and we've had to figure out how together we can fix it. And that in itself, just Sunday morning with complications, is a reason to come to Houston. Guys, anything else? Please chime in here. And
yeah, I always love to go into Houston besides Brazil and now Madrid. I feel that is my second home. I love the barbecue. I always find time to dig some old vinyl record stores, and this year I promised to buy my boots there to be the
we got to
same
get
level as you are.
Dave, we got to get him some
And
going.
yeah,
Definitely.
and I really am amazed with the quality of the restaurants and food. So besides the course that is no doubt amazing, the opportunity to be there, it's also super cool because we will be guiding you in everything you want to do there. So yeah, I'm excited, Todd. I'm excited, David, to be there with you guys. And I really hope to see those who are watching us in this webinar there to start taking part of this community.
Danny, I was just thinking it'd be fun if we can catch a Rockets game together.
Yeah, Rockets game, and if you can come in on
But
Tuesday.
in January, it's possible. It is my dream, right? I really love basketball.
Yeah. We'll check
I'm
this.
an Astros fan
We
too,
should.
because I now being part of
You're a
Houston
Houston
family,
guy.
I'm an Astros and Texan. I have all the hats.
Yeah, David,
So
idea. We'll look into the Rockets, but I think you should come in a day early so we can go get some custom boots started too.
well, I am already blocked my agenda. Thought you need to save space in your house there for me for 1 week, probably.
Yeah. Bring it for sure.
Cool, man.
David, anything else to close us out this morning?
If you're interested in coming into the operating room that week and seeing jaw surgery case, let us know. Any one of us can get a hold of me. We do have some capacity to bring people. Last time, I think we had about 6 or 7 people in the operating room.
Yeah, all of them, they wanted to do orthognatics when they left. I don't know
After
what
that,
happened
yeah.
there. It was so fast. MMA surgery, 1 hour, a big guy. Everyone was so impressed. So if you want to be there when subscribing, mention that you have interest, and then Jacqueline, the team, will contact me. I will organize it. Okay. Initially, this is an exclusive for DST clients and members, but it will depend on the amount of people that really subscribes. Yeah,
for sure. And a couple more housekeeping. Jackie, project manager extraordinaire. Jackie manages this. If you have problems with the website, we're redoing the website right now. We've had glitches. Please call us. Perio Health Professionals. Ask for Jackie. 713-783-5442 and ask for Jackie. Jackie will take care of you. She'll figure it out, and she'll get you registered. She'll get you the discount that's running. I don't even know what discount. I think DSD clinics get the 20% off. I think we have another discount code for ASAP members.